Assalamu alaikum. Good morning. So, from today, we'll start a new kind of understanding of the subject of urology, and that is the cutting edge technology. Uh, Urology, to my understanding, again as a student, is always at the forefront of something which is not shy of taking on any technological advancement, whether it's remote sensing, whether it is something which is physical as electrical current for the use of dissection or coagulation, or for that matter, laser, which originally was not introduced for any surgical purpose. It was a tool which was for, again, remote sensing. But the technology can be used in many ways. It can cut or it can heal, both ways. So you can destroy something with, again, a laser pathfinder or a laser bomb, or you can just pinpoint whatever you want to present during your presentation by means of this pointer, which is in my hand. So it is as innocent as something which is healing, and it is as devastating as something which is death. So technology gives you both of these things. It's a double-edged sword. But before using something as us, the healthcare provider, we must know what's the physics is, and not to the extent that somebody is asking for designing of an instrument, but whenever you want to play with something, for instance, you want to drive a car, you know the basics of how to drive a car or how to just tackle the problems. So the basic principles of electrosurgery, that is our main goal today and tomorrow, and the laser application. So electrical current, or the spark which you have, is actually between the two electrodes or two pointers which are conductors. So it is originated from the spark gap transmitters, which we use in many ways for the generation of radio waves. So they fall in the category of radio waves because of the wavelength, and electrosurgery uses the radio frequency in the range of 400,000 to 600,000 hertz. Now, electrosurgical device again is very basic. It consists of a generator and electrodes, which might be uh, active electrodes or passive electrodes, but there are only two electrodes. The difference between monopolar and bipolar is, in a monopolar setting, one electrode is active. It carries the current to the tissue. The current then spreads through the body to be collected by a dispersive electrode, which is an indifferent electrode placed somewhere else on the body. For instance, in our case, on the thigh or the shin. The bipolar setting actually has two electrodes which are active, both of them, and the current passes between them, and it is not dispersed to the indifferent electrode because there is no one. So this is the kind of diagrammatic representation which you can have for the understanding of the generator, the generation of current going to or pointing to a biological tissue, and then it spreads to the body or between the two electrodes at the same point, as is shown in the second figure there. So the mechanism is, we want to have two kinds of maneuvers or results. One is the coagulation, the other one is the dissection. So electrocoagulation occurs when the tissue is heated below the boiling point, and this causes denaturation of proteins. The denaturation process starts at 45 degrees Celsius. So it is in the range of between 45 and 60 degrees Celsius that the protein structure is changed. We call it denaturation. Further increase in temperature leads to vaporization and tissue desiccation, leading to electrosection or electrocutting or electrodissection. As more superficial coagulated tissue dries out, when you do some coagulation, there is some superficial surface which becomes dried of whatever water is in it. So it becomes electrically less conductive. It doesn't allow the current to pass through. and then you see the spark. You see these sparks whenever you do some electrocutting during resection of the prostate, or when you do something with the tip of the electrode that you use during dissection on the surface of the body. For coagulation to occur, the current is interrupted. This is the main basic concept, and it is interrupted at the frequency of 30,000 times per second. So it's not a continuous electrical current, which is, again, there are two kinds of current. One is the direct current, the other one is the alternating current. So this is the alternating current. This is not a direct current. It comes in waves, but the distance between the waves is too short here. In 1 second, it is to the power of 30,000. This interruption results in short bursts of radio frequency energy. For cutting current, the radio frequency current is delivered continuously. So this is the difference. One is the continuous current, the other one is the interrupted current. When energy is interrupted for the purpose of, again, coagulation, the cells are allowed to cool down in between the heating process, and the cells dry out of the water. When energy is delivered continuously, as I have said earlier on, for the cutting purpose, the cells heat up to the point of boiling. Now they are going above the 60 degree or 45 degree centigrade period, and then they become ruptured. They are not dried out, they become burst out, or they ruptured. There is another form which is known as blending of currents. This is the addition of coagulation properties to cutting current. So you have got two kind of options on the generator. You can do coagulation alone, you can do cutting alone, or you can blend both these currents. For instance, when I was trained by a very senior person, none other than Professor Rizvi, he says to me that when you want to do dissection or TURP, you always use coagulation current with blending. So that would increase the coagulation process. It will cut the tissues, but it will not lead you to a lot of bleeding that we see. So we used to train our juniors, at least I was trained like this, that we used to dissect through the cutting, not through the cutting mode, but through the coagulation mode by increasing the power of it and blending. The fourth process is fulguration. Now, when the electrode is placed not in contact, but at about 2 to 5 millimeters from the tissue, the electrical energy, again, it jumps up. It produces an arc, and it produces a spark from the electrode, and that sort of creates the fulguration or spraying, as we call it. Now, if you want to have a diagrammatic representation, you see, if it is 100% pure cut, then the distance is very minimal, almost continuous current. There is no gap, there is no rest period. If you go on to blend, you can have three different kind of options. You can blend 50% on, 50% off. That means 50% coagulation, 50% cutting. Then you have got 40% on, 60% off, which means again 40% coagulation, 60% cutting. It goes on and on. So it depends upon your understanding of the technology and the use of it for the purpose of anything that you want to achieve. If we want to have coagulation, again, as you see here, there's a large gap. There's a large gap of rest, and this rest actually cools down the tissue, and the tissue is dried out rather than burst out. So what is plasma? Plasma is actually an ancient Greek word which means moldable substance, and we try to figure it out as the fourth state of matter. It was first described by chemist Irving Langmuir in 1920s. Plasma is defined as electrically conducting medium in which there are roughly equal numbers of positive and negative charged particles. What you do is, if there are three states of matter, one is solid, liquid, gas. And both these three states, or all these three states, they differ from each other just because the purpose of because of the reason that there is a space between the individual atoms. So the bigger the space, it becomes gas. The lesser the space, it becomes solid. What happens to this fourth state is if you try to increase the temperature of gas, then it becomes an ionized gas. Either it is positive or it is negative. Either it has got electrons more in it or it has got protons more in it. So if you want to summarize this concept of plasma, it is nothing but ionized gas, and it acts like a fluid. It has got a fluid property, fluid dynamics, which means it can go on like a fluid. It has got ripple effect, it has got waves. So it can move from one point to the other. So that's the concept. The temperature when matter starts to behave as plasma is between 6,000 and 10,000 Kelvin. Now again, this is a very high temperature. A plasma can be artificially generated by heating or subjecting a neutral gas to a strong electromagnetic field to the point where an ionized gaseous substance becomes increasingly electrically conductive. So in simpler terms, it is an electrified gas. You can produce this gas, electrified gas or plasma, by means of three things. One is electrical current, the other one is electromagnetic or simply magnetic, and the third thing is laser. So all these things which create some disturbance or hindrance to the passage of any source of energy, then the gas becomes electrified or it becomes ionized, becoming plasma. The electric, magnetic, gravitational forces, they act on plasma, producing some of the properties of plasma, as I've said earlier on. If it moves from one point to the other, it becomes kinetic. It, if it is at the same point, it has got its own potential. When electromagnetic forces act at a large distance, plasma will act much like a fluid, as I have said earlier on. Nearly all visible matter in universe exists in the plasma state, as in sun, interplanetary, between the planets, or interstellar, between the stars. At present, we call it dark matter. If you want to go into cosmology, for instance, they call it dark matter, but in effect, it is plasma. Auroras. Now, anybody who wants to know aurora has to go to the poles, either to the North Pole or the South Pole. And in the evenings, they have got dancing lights of red, blue, maybe different green color. And these are known as auroras. They are nothing but gases which are electrified, ionized gases. They produce something. You see, when electron jumps from one state to the other, light is emitted, as we have all studied in our FSC. So this is the same phenomena. Lightning, whenever there is some rain and there are clouds, lightning is there. It is one of the examples of plasma. Welding arcs. Now we have all seen welding arcs. This is actually plasma. Neon signs. This is all plasma. We have got now bulbs. They have got, for instance, this tube light. It is working on the principle of plasma. These are the fluorescent tubes. So a plasma may be produced in the lab by heating a gas to an extremely high temperature, which causes vigorous collisions between its atoms and molecules so that the electrons are ripped free, so that the electrons can move out. At sufficiently high temperatures, the atoms are stripped of all electrons. So if you keep on increasing the temperature, the electrons then move out. And the atoms are stripped of all the electrons. For instance, if any atom is in front of you, if all the electrons are out, it becomes a bare atomic nucleus. At temperatures of 1 into 10 to the power 6 or greater temperature, nuclear reactions can occur. So this is the same process of heating something which becomes nuclear reactor. So it is the thermonuclear reactions which we call as fusion or fission reactions. So this is a very simplified diagrammatic representation. There is an electrode, as you can see here in the upper part of the picture, and there is a cell line which is all over, and there is a tissue in front of it. There is another electrode which is the active electrode. So both the electrodes are active. This is a bipolar sort of a system. And there is the production of something called plasma. This plasma is actually the saline or the gas or whatever is in between these two electrodes that becomes ionized. And this ionized plasma pocket will actually give you something called electrodissection or electrocoagulation. So, what are the treatment options? If we come back to the topic of prostate, the plasma kinetic energy provides solutions for different prostate sizes, anatomies, different patient profiles. For instance, we have got patients with arrhythmias. We have got patients who are not fit for surgery. We have got patients whom there is renal failure. We cannot use a lot of saline or water. So these are different patient profiles. For example, high risk patients, patients who want the ability to maintain antegrade ejaculation. So we need something which can do away with every aspect of patient profile. So the treatment options in the context of bipolar energy production and production of plasma in the kinetic motion is resection with resection loops in different sizes and angles, as we will see later. Vaporization with oval and round vaporization buttons. So that's the coming new technology, and it gives you something which is better than what we are using now. Enucleation with a special loop. There's nothing different. This is the same kind of planning that you do during dissection of prostate during TURP, but with a different setting of instrument, with a different design of an instrument, and in different understanding. So these are the different kinds of loops that you have. They have got different angles. If you appreciate the last bit of this picture, and these angles actually give you something. For instance, if you want to resect, there is a 60-degree angle. If you want to do some en bloc dissection, then it is not 60-degree. It is rather less than 60, maybe 45 degrees. And if you want to push this tissue away from yourself, then again the last one, the bottom one, it has got a different angle, which might be obtuse from down below, which might be acute from above down. Now, just to give you an example, how this bipolar plasma kinetic resection of prostate takes place. This is just a TURP, but with a different kind of understanding. And mind you, this person, Jose Maria Gilverne, whose video is this, is the grandson of the famous Gilverne. He's still working in Barcelona. So what you do is, whenever you want to do something called TURP, you always inspect the prostate. You go into the bladder, you come out of the bladder into the urethra, take your position over the verumontanum, start your dissection at maybe 6 o'clock position. Maybe there is a little bit of median lobe, or maybe it's a bigger median lobe. So you start somewhere, either from right side or left side, or from the middle. It depends upon the particular kind of anatomy that you have. And then you start resecting. Now, since it is a bipolar and plasma kinetic energy is used, there is the application or usability of normal saline. As you can see here, there are less sparks and there are more of energy concentrated to the point where you are actually dissecting. So if any fluid is absorbed, it will be isotonic. And it's the same thing. You start, as I've said earlier on, you start from 6 o'clock. Either you go on the right side or you go on the left side. But the purpose of doing it is you have to work between 2 points. One is the bladder neck, the other one is the verumontanum. And on the sides of verumontanum, you have to be particularly careful because there is the attachment of external sphincter. So the shoulders are on the sides of verumontanum, have to be seen again and again, and the surgeon makes himself or herself comfortable that he is not actually violating the space and the boundaries. So if you understand the basic principle of dissection, whatever instrument is in your hand, whether it's a monopolar or a bipolar, you can do a very good dissection. But the benefit of using a bipolar is uh, there are less complications vis-a-vis TUR syndrome. And the best thing about doing a dissection and resection is whenever there is some bleeding, you just check the bleeding first. Don't proceed onwards. Otherwise, the whole picture will become murky. It will not be visible to you, and you have to abandon. For instance, in this case, as the tissue is cut, there is an opening of a sinusoid. You just coagulate it at that point first. So if your instrument is not in contact with the tissue, as you can see somewhere, there is a spark phenomena. But if your tissue is actually engaged by the loop, then you can see the light but not the spark. The spark is white. The yellow light is actually not the spark, it is the heated electrode. So it is basically something which is like a chiseling or like a sculpturing. So you make some say planning in your mind, and then you do your work or dissection according to the anatomy which is in front of you. There is not one patient which is like similar to the other patient. All two patients, they are different. Every patient is a different patient with a different anatomy. The second thing is whenever you want to do, as I've said earlier on, between 2 points, one is the bladder neck, the other one is the veromontanum, you must be sure that you don't undermine the bladder neck. Otherwise, the continence which is provided by the bladder neck will be lost. And the patient, no matter how good work you have done, patient will become incontinent. So the process of continence depends upon two things. One is the voluntary, the other one is involuntary. The voluntary part is the external sphincter. The involuntary part is actually the length of the prostatic urethra, which is compromised when you do dissection and resection. And the second part provided is by the bladder neck. So if you undermine the bladder neck, you will actually causing incontinence. So it's a fine balance between these two things. One prostatic length, the other one bladder neck undermining. So you go layer by layer, chip by chip, and every now and then you must make yourself comfortable that enough anatomy has been done, and whatever amount is left, you have to take out. You have to also make yourself comfortable with the time and the amount of fluid that you have resected. The second thing is the plasma kinetic bipolar electrovaporization. Now it has got a different kind of an electrode. It's a bipolar again, so the current stays between the 2 points, and it's a button. It's a button which causes, as you can see in the far right side, it causes and produces the same kind of a TUR fossa which is created by means of resection. But then you don't have the luxury of having tissue for biopsy. So how it goes, we'll see. This is something which is on the horizon. It is something which is available. It is something which is cost effective again, because this is not a loop, it's a button. It can be used in in many patients. The same principle, you have to make sure where is the bladder neck, where is the veromontanum, which lobe is the predominantly enlarged lobe. It has got, again in this case, a median lobe. So the person who is using it, before just um, just owning the patient or just starting the procedure, has to make all the adjustments where to start. So the person is starting from again 6 o'clock position because there is a median lobe. So it depends upon the anatomy again in front of you and the patient. Every patient has got a different anatomy. You see here, you just have to iron the tissue. You just have to do some contact, and you have to slip the button over the tissue so that tissue becomes coagulated or vaporized. So this uses less force of your hand, more contact, and the precise, say, sweeping action. But the beauty of this procedure is there is less bleeding, almost no bleeding at all. So it can be done in those people who have got problem with coagulation. Again, you don't have to go over to the verumontanum. The person is seeing the verumontanum and the shoulders on the sides of verumontanum. So the principle remains the same, whether you do resection or you do electrovaporization. The irrigating fluid here again is normal saline. You, we'll come to the cost. We stick to the technology first. Any technology which is introduced is in the initial phase is costly, but when it is used and when everybody is convinced, then the cost comes down. The first thing is we have to make three different trials, phase 1, 2, 3 trials, and then collect the data in order to produce something or reproduce something which is credible. So now we have got literature that supports this technique, the button technique. But the fallacy again is you don't have the tissue for biopsy. See, you now have the fossa, which is like a TUR fossa, verumontanum, the bladder neck, and the sides, all three clear points. The third thing, bipolar enucleation of prostate. Now, there is now a debate between resection of prostate and enucleation of prostate, which is the better. The literature is in favor of having enucleation because it does away with something called the TUR syndrome. It does away with bigger prostates easily. It does away with something which is of benefit. So how does it work? It has got a different kind of electrode. Again, from one end, for instance, this part, the blacker beak is actually lifting the tissue, and the electrode which is there is actually cutting through the tissue. How does it work? We'll see. This is the way. You see, you have to make again sure that you see both the ends, the blacker one and the silver one, because the silver one is actually the cutting point, and the blacker one is actually lifting the tissue, creating some space beneath. And again, it is plasma kinetic and bipolar. It's a retrograde cutting because you have to lift and then cut, lift and cut. And it does it on its own self because there is a space in between the two electrodes or the two, say, loops. And we have got one. We have got here. I've brought it for the purpose of observation also. Yes. Either yeah, either you morselize it, or there is a second way of doing it is whenever you take out the whole tissue and it is still attached with the stalk at the bladder neck, you do cutting over that stalk. You don't cut the stalk. You cut through the chip by chip the whole gland which is attached is still attached. So there is ways and means of doing away with a costly thing called morcellator. And I have seen reports when the the whole prostate is enucleated, it is pushed into the bladder, and then a small incision is given on the bladder, and the whole gland, which is like 100 or 200 grams of prostate, is taken out, just like we do in cystoscopy. This is a very small incision. So if you don't have morcellator, again you can do this enucleation of prostate, but it's better to have morcellator. It gives you a lot of benefit. So you can rotate the angle, rotate the instrument, see the anterior portion, and then do your dissection. The last thing is the bipolar en bloc TORP. It can be done with the button also. And how it is done, we'll see. You can, if you are an experienced person, you can do it with a loop. You can do it with a Bugbee electrode, or you can do it with this button. The benefit of having button is it is bipolar, but with Bugbee you can have monopolar. You cannot have bipolar. Uh, Now, if you combine en bloc dissection with a blue light cystoscopy, you can have clear margin where you are going. So it depends upon you. It depends upon the facility that you have. For instance, you can circumscribe the whole area which is having the tumor, and then you deepen that portion. And how deep you want to go can be seen through a blue light. You turn on the blue light, you see where the color is. So it's a disc. It's a disc which is containing the tumor. So you go on deepening that disc so that the whole disc is taken out. The benefit of having a bigger surface like a button is you can dissect through the edge of the button, and you can also dissect through the base of the button. So the button gives you a lot of benefit, and it is easier to use rather than training someone on a loop. So it's better to have this thing for a junior person. The learning curve is shallower. It's not deep. Can we? No, no. Here you are doing en bloc dissection. The dissection process is different. This is not prostate. This is tumor in the bladder. So that's it. These are the four different kinds of technologies which are available in the context of plasma, in the context of electrosurgery. But the whole story is not complete without having other technologies for prostate, and one of them again is laser. So I'll call upon my friend Dr. Haris to take on you to laser.
One question,
Yes.
because I am not clear. I was searching the comparative papers with Turis and this plasma kinetic both. So I could not find. So I am asking that
Right,
is
sir.
there any comparison between Turis and this plasma kinetic TRP?
You see, whenever you do use electrical current, it is basically a plasma which is used. There is no difference between Turris and plasma. Turris and plasma are both the same. The understanding now is what happens when you use laser or what happens when you use electrical current. It's basically creation of plasma by any force which is applied, any source of energy that increases the temperature. So it's the same thing. But actually, the company Olympus has used this term plasma, which is in capital letters, for their own purpose of marketing. Plasma for marketing is something different. Plasma as a source of energy, as a fourth state of matter, is something which is different. So whenever you use electrical current on the surface of the body by means of an electrode, it is again creating plasma. When you use, as we have done it earlier with the resecting loop and monopolar instruments, it is again plasma. So plasma is the energy which is actually causing everything. So this is the same. We are unifying all the energies together.
Juris and plasma kinetic TRPs are same.
Yes, yes, they work on the same principle. But sometimes what is there is the companies use something for their own marketing purpose. So in capital letters, if they use it, it is only Olympus instrument. So this is the Olympus instrument. They call it plasma. This is not plasma. Plasma is something which is in physics.
Thank you, sir. So I'll be discussing about lasers, and this is a laser as well. Can you see? But this is less damaging. So a bit about laser. What does laser mean? Light amplification by stimulated emission of radiation. What does that mean? Anybody read about it? Yeah.
Basically, when you talk about this particular full description of laser, that is, it explains the phenomena what we have read in physics, that atom is a part, the basic unit of everything, and is surrounded by an electron which is revolving in its fixed axis around atom. And whenever a source of energy is provided to that atom, it absorbs by the electron, it moves a higher state of energy, and in some milliseconds it has to come back to its ground level energy or ground state of energy. In that particular movement, it releases a photon, and that particular photon is responsible for this emission of radiation, what we call as laser.
Very nice. This shows that you have read it, because a lot of people don't have this clear mechanism, and we'll be discussing it later. A bit about history, and then we will go about that mechanism. Albert Einstein proposed the concept of stimulated emission radiation in 1917. In 1960s, Manon used a synthetic ruby crystal, silver coated end surrounded by the flash tube, to produce that energy light which we were discussing. In 1966, Parsons, using a similar ruby laser in a pulse mode, and the first urological experiment. We will be talking about all the types of laser from start to end, that what are the types of lasers which can be used. Mulvaney attempted to fragment the urinary calculi 2 years later in 1968, again using the ruby crystals. And subsequently, researchers tried to find out about the new laser techniques. And so, a bit about the concept of laser. First of all, we have got a chamber. Chamber is the machine in which we place the crystals as well as the components over there. So if you, for example, use holmium YAG is the crystal which is present over there, on which you place holmium substances over it. So one end of the chamber is, both ends have got mirrors. The initial one has got complete mirror. The one has got, you can see a hole in it that the laser beam can pass through it. And flashlight uses, whenever you flash the light, then that mechanism which Dr. Shua told occurs. So we'll be discussing it again in the later slides, but you should be having a concept of this gain medium. Gain medium can have water, liquid, gas component, and then the whole story starts. And as he told us that gain medium contains large amount of atoms, and with a central nucleus and an orbiting electron. Whenever you flash the light, this electron, this becomes active. Starts moving and revolving in an active state, and then after the energy is absorbed in it, and then it goes to the ground state again. This going in a very big ground active state, it goes into the ground state, and when the ground it goes into the ground state, then the photon is released. The photon is released, that is called spontaneous emission. And once this spontaneous emission occurs, we have got one photon, and that photon interacts with the excited atoms again and releases another photon. So from one photon, you get another photon. It activates the electron, and we get two photons. So that is called simulated emission. So this is the concept of laser. That what does laser mean? Except to anybody else, what does laser mean? So this is what happens. Have you got the concept? There was a atom, electron, active state, ground state, photon released. That photon multiplies into another photon. From one photon, you get another photon. So it stimulates and multiplies. So that is the basic concept of laser. This is the gain medium which we were discussing. This is the crystal. If you take the example of YAG and holmium, and then the light flashes, and then the same story of the electron photon, and then the laser is passed through this. So if the light goes out of this, and then after that machine, a fiber is attached, and these are the number of fibers which can be used. So we have got Dr. Asad has got us a fiber as well. So this is how the fiber looks like. We'll be discussing fiber in detail. This is a laser fiber. It has got an end. This is connected to the machine, and you must have seen it. ठीक है बाद में आप देख लीजिए. So what are the properties of laser? We've got different lights. Over here there is a light, over here there is a light. There's a difference between this light which is coming from the top and this light. It is going very straight. What this has got difference. So the laser has got three properties. One of them is coherence. In this you can appreciate that all these, the laser light, all these are in the same pattern, and in this you can see one is going down, one is going up, one is going down. So they go in the same phase. If somebody is going like this, all the laser light will go like this. They won't cancel any other. So that is why you see a beam of light like this. So this is the first property of laser. The second property is collimation. Collimation means that they go in the same direction. They won't go like one is going there, one is going here. They all will go in the same direction. So that is a property of a laser. And third is monochromacity. They have got the same wavelength. If one has got 500 wavelength, the other will have 500. So on the electromagnetic field, they will be having the same wavelength. Are you getting it? So this is the difference between this laser light and this other lights you can compare. So a bit about properties of laser. Laser can be described with four concepts: energy, power, fluence, and irradiance. Anybody has any idea about it? आपने पढ़ा होगा कल मेरा ख्याल से इसके बारे में. So we'll be continuing this tomorrow as well. So you people read, and if you want this presentation, I can email you the PPT as well. But don't come blank. You should be knowing about it because this is very important. Energy describes the amount of work accomplished and is measured in joules. Power refers to the rate of energy expenditure and is measured in joules per second or watts. Joules per 1 joule per second equals to 1 watt. So I know it is a bit basic and everyone is yawning, but still, this is bookish. You should be knowing it. So the total energy applied to a given tissue is the function of power multiplied by the duration of time the tissue is exposed. Okay, fluence is the density, and joules per centimeter is how we calculate it. Irradiance is the intensity of beam. This beam, there are multiple beams. This is non-damaging beam. If it goes to your eye, infrared. Previously, the mobile phones used to have infrared before Bluetooth, and you can use to change the channels, and you can use it as a remote as well. That was also a type of laser, and this is also a type of laser. And the laser which we are using in for stone fragmentation and prostate, that is also a type of laser. So, intensity of laser beam is also important. So a bit about biophysics of laser. Molecules, proteins, pigments may absorb light only in a specific range of wavelengths. Hemoglobin, for example, absorbs light that has wavelength of as high as 600. If it is less than 600, you won't be able to absorb the light and it won't work. So that is why argon laser was used in liver surgeries, the bleeding. We used to use argon laser, and it was heavily absorbed by hemoglobin. That is why it got publicity and using it while there is bleeding on the rough edges of the surfaces. Water also absorbs in a specific wavelength, beginning with a small amount of absorption, 300 to 2000 nanometers, at which the point the degree of absorption increases and continues several thousand nanometers. The CO2 laser produces light in the infrared spectrum, and it has got the highest 10,600 nanometers. There is a electromagnetic band on which I'll be showing you the image, so you'll get to understand that what I'm talking about. Local tissue properties combined with wavelength of laser light further affects the quality of laser tissue resection. Examples of tissue properties include density, degree of opacity, water content, and blood supply. Why we are discussing this? Because when laser, we'll be discussing it tomorrow when we'll be discussing Moses. The technology which started was for atherosclerotic lesions, not for stones and prostates and tumors. So initially they thought that if we go through the blood medium, the laser works well. But later they compared it with the saline and blood, and then they came to water. So they thought that this is how things changed, the laser evaluation. So this is why this is important that we should be knowing about. The more dense or opaque the tissue is, the greater degree of absorption of light energy, the greater degree of transformation of to heat. So this is also important that you cannot keep the laser over there, it will damage the tissue. A bit about laser fibers. So we are short of time, so we'll be continuing this tomorrow. So you people, I'll tell you what to read about laser fibers. What are the types of lasers? And I'll show you one image. You should be this. These are the types of lasers you should be knowing about: KTP, holmium, thallium, CO2. Read about it, and then we'll be discussing it. Otherwise, it will be a very dry topic, and everyone will be sleeping.
Well, it is thulium rather than
Thulium.
thallium. Thallium is something else. So, why we are stressing on technology is from, I think, today onwards, we'll start another thing, another chapter in our presentation, and that is newer technology. We'll always like to discuss technologies maybe every month or after 2 months, because this is the understanding which urologists of a 21st century must have. These are not toys in our hands. These are something which have got serious implications, producing complications if you don't use them in correct way. And this is something which is again a station in 12 station out of 12 stations in FRCS urology. This might be another station or another question in days to come in FCPS urology. So this is something which you all have to learn, you all have to understand. So we'll understand together with you, all ourselves. Everybody is a student, even otherwise. So
So we'll be
we,
continuing.